So start by saying that we are indeed curing cancer. And I brought here two famous examples of famous people who have been treated for head and neck cancer. One of them was treated at our center and was cured, Grant Eckett. The other one is famous Michael Douglas. However, not all patients fare as well, and due to a variety of reasons. One of the reasons that I'll be talking about is what I'm calling the financial toxicity. And what I brought here is basically a piece of news that basically reports on this patient who killed himself after being told that he had refused a wonder drug by his local primary care trust. From the news, in desperation, he offered to pay for the treatment, but he was told if he did so, he had to foot the bill of the rest of his treatment, which he could not afford. So what's the data on this? So we don't have a lot on head and neck cancer, but basically from the other kinds of cancer, on this survey that I brought here in one slide, 216 patients with breast, lung, or colorectal cancer who had received treatment for at least 1 month were asked about their financial burden. So 39% of this sample described their financial burden as moderate, 30% as significant, and 11% as catastrophic. 70% of these patients reduced spending on leisure activities, 48% used all or a portion of their savings to pay medical expenses, and 18% had to sell possessions or properties. So although national media attention and public policy has focused on the cumulative costs of care at the macroeconomic level, the burden on that individual patients that we see in clinic is very substantial. So how does it relate to what I do, head and neck cancer? So we have about 50,000 Americans who develop head and neck cancer every year. Our combined modality treatment, including surgery, radiation, chemotherapy, has been successful in achieving cure rates greater than 80% at 5 years. So we are curing patients. However, these patients, after we cure them and even during the treatment, they have a lot of comorbidities. And for example, a cross-sectional study examining work-related disability among patients with head and neck cancer showed that 52% of these patients who were employed at the time of diagnosis were unable to return to work after treatment was completed. It's easy to imagine it's an area where we talk, eat, breathe. So in comparison to other types of cancer, survivors of head and neck cancer have the highest risk of disability or quitting work. So the last slide, just to give you what we are trying to do. With the hypothesis that this financial burden in head and neck cancer is very substantial, and that the patient-reported financial toxicity independently correlates with the quality of life of these patients. In this project, we are trying to measure the extent of financial burden in head and neck cancer patients, and also to develop and validate a subscale of a quality of life instrument to measure this burden in these patients. So that's a brief 5-minute overview of what we are trying to do, and I don't know if I should ask.